Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But let's begin with the illusion of the week. Okay, here's a trick with a deck of cards. And we're just going to wipe the front of the edge of the cards a couple of times. And as we wipe the cards, we find that sooner or later they change. Real close. Wipe the cards, wipe the cards, wipe the cards, wipe the cards. Ten of clubs can become the eight of spades. The eight of spades becomes the five of spades. The five of spades gets smaller and changes to the four of spades. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, I certainly hope you enjoyed this week's magic trick. Right now, Root Tip of the Week. Hi, I'm Dr. Kit Weathers, and I'm the Director of Endodontics for the Las Vegas Institute. I've been a clinician for over 35 years, and I've been teaching general practitioners all over the world how to perform stress-free and profitable endodontics. Now, over the years, I've seen a lot of changes in endo and the techniques that are being used. One product that I have been both using and teaching in my endodontic courses for many years is Medidenta's Sonic MM1500 handpiece. Begin by inserting the file into the MM1500 handpiece. You can either use the Rispy Sonic or the Shaper Sonic, but I prefer the Shaper because it's much less aggressive than the Rispy. To insert the file in the handpiece, simply pull back on the cone, slide the Shaper Sonic up from the bottom through the little wire depth gauge, and once you place the file in at the proper depth, let the cone slide forward. You can adjust it at any length. There's a built-in depth gauge which allows you to position the file exactly to the depth you want, and it will not go any deeper than the depth gauge to the working length. Once the file is inserted into the 1500 handpiece, you can adjust the tip until it oscillates back and forth between 1 and 2 millimeters. The adjustment of the tip is done by turning the little knob at the base of the handpiece. Turning it clockwise speeds it up. And once you get the file going at the proper oscillation speed, then insert it into the tooth. Insert the file until you feel resistance, back up a couple of millimeters, then turn on the handpiece. Once you begin cutting with the handpiece, the water spray goes down the file, and you use a series of backward strokes, cutting circumferentially around the inside of the tooth, wiping all of the walls of the inside of the canal. This will get the irrigating material to all parts of the tooth. You can then complete the preparation using your standard rotary instruments. When the preparation is complete, go back in with the Sonic handpiece without using any water spray, and you can use it to irrigate and activate the sodium hypochlorite that's in the canal. Use the Sonic irrigator file, which is a non-cutting instrument that's designed specifically to activate fluid in the canal in a sonic acoustical streaming manner. Don't forget to turn off the water when the file is inserted into the canal. The acoustical streaming forces the irrigating material into lateral canals and all of the little fins and nooks and crannies to do a much better job of irrigation than otherwise possible. We only use the Shaper Sonic number 15. That's the only file I use. And I use that not only to flush the canals, but I also use it to remove debris along the walls of the canal. And here's a very important point with Sonics. You cannot use them to gain length. You must use the Sonic file loose in the canal. Now these days, many clinicians recommend soaking the canal with sodium hypochlorite for 30 to 45 minutes. Now, a recent study in the Journal of Endodontics said that if you will activate that solution of sodium hypochlorite with a Sonic file for 2 minutes, you get the same result as if you just soak the canal for 32 minutes with sodium hypochlorite. So if you'd like to increase your clinical success when doing endodontics, and have less post-op problems, I recommend adding the MM1500 handpiece to your present armamentarium. You'll be glad you did. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the next Endo Root Camp.